I'm Dr. Jolly Thomson. I focus on clinically supported lifestyle correction for treating chronic lifestyle diseases. Here, I would like to share my professional experience with this approach. This series is about my experiences with patients who took clinically supported lifestyle correction to avoid surgery and reduce and stop medication. This can help you understand how valuable are the lifestyle corrections needed for overcoming any chronic lifestyle disease. Most importantly, what advantages such an approach has when deciding on surgical procedures or continuing with the lifelong medication. Here we learn of the approach for a patient who is 49-year-old male, who is suffering from diabetes for the last 10 years, and present problem is he had a heart attack 2 weeks back. It was a STEMI, actually ST segment elevated myocardial infarction involving the anterior myocardial infarction. An angiogram showed 3 vessel disease. A stent was put along with the primary angiogram, primary angioplasty one stent was put. But the doctor said he need more stent because in his condition they were able to do one only. And he was advised to, fourth day, again one more angiogram and angioplasty was advised. But on the third day, they had done a echocardiogram and it showed basically blood clots inside the left ventricle. Apical area, large left ventricular apical clot was found. And so they advised not to do the angioplasty now, and they will wait for another month and they will repeat an echocardiogram again to see the clot is gone, and then after 1 month again angiogram and angioplasty. He is having, on examination, he is having chronic kidney disease also. His creatinine is high, maybe because of this angiogram that dye is injected. No? So dye can make problem for the kidney. Maybe because of that the creatinine was increased to 1.2 actually. It was increased to 1.5 initially, and then after maybe that effect is over, then it is come down to 1.2. And also his PSA was increased, and he is having prostatic hyperplasia. And prostatic hyperplasia with PSA means prostate enlargement, with PSA means prostatic cancer. That is the diagnosis. And also he is having Peyronie's disease, that is thickening and fibrosis of the penis with pain. So he is suffering that also, but he was not giving that much importance for that actually, but it was paining also. And on examination, fatty liver grade 1 is there. And he is taking 13 medicines, actually 15 tablets per day, and need repeat angiogram and stent, or if the stent is not possible, a bypass surgery has to be done. Here I will try to explain how the surgery could be avoided, how long it took for multiple medicines to be reduced and stopped, how long it took to get relief from symptoms, and progress evaluation based on corresponding improvements in the periodic tests. When we come to the details of the patient, is a 49-year-old male, height 171 centimeters and weight 71 kg. And his fat percentage is actually 25.2%, and abdominal obesity is there. Abdominal circumference is 90 centimeters. And as we have said earlier, the diabetes is there, heart attack, coronary vascular disease is there, and kidney CKD is there, and prostatic hyperplasia with PSA high. So the chance for prostate cancer is there. And it's a Peyronie's disease actually. It's a rare disease actually. It is a sort of autoimmune disease, some sort of rheumatism it can be called actually. So it is affecting, only the problem is it is affecting the penis. And so it can be a progressive disease also, and fatty liver, and taking so many medicines, 13 medications is already on. And he is advised to have repeat angiogram plus angioplasty, or if that fails, go for a bypass surgery. So when we come to the category of the disease, for the clinically supported lifestyle correction, we have categorize what is the category. It doesn't matter which is the real diagnosis. The exact diagnosis is not that important, but the category is actually this patient is metabolic syndrome. That is, usually we call it the X syndrome and all. So it's metabolic syndrome, that diabetes, hypertension, heart disease is there, and also autoimmune disease, that is this Peyronie's disease and the cancer, prostate. Suspecting cancer, where not a biopsy diagnosis is there, but the PSA is high, and scanning there is hypertrophy is also there. Next, when we come to the patient's discomforts, actually symptoms wise, before starting, actually he's, even after this problem, he's having a chest discomfort is there, echo pain is there, and tiredness, severe tiredness, and he's feeling sleepy. And the penile problems, pain, swelling and pain on the penis also is there. Then about the medication, actually, he is taking aspirin and clopidogrel tablet, that is blood thinner, along with that Alexiban, that is another blood thinner. So he is taking Apaxiban twice a day, the other one once a day. So 4 tablets actually for the blood thinner itself, because there is a clot is in the heart. So maybe because of that, usually 2 medicines only usually given, but for him it is 3 medicines and 4 tablets is for that alone, maybe because of the clot. Actually this is actually not a it will not lyse the clot. For the lysing of the clot there is another medication, maybe it was have been given in the ICU itself, and this is to prevent further clot formation actually. And next is and along with that he is taking pantoprazole, that is for the acidity. Usually this, as all these medicine, aspirin, clopidogrel, all will be very acid and ulcer creating, so pantoprazole is given. Then is ivabrandine, that is taking 1 morning and evening, okay, 2.5 milligram morning and evening. And flavadone, that is another medication for the heart, that is 1 morning and evening. Stovos, that is atorvastatin, 40 milligram once daily. Promolate, that is metoprolol, it's a BP and it's a beta blocker for the heart and the BP, that is once daily. Another spironolactone, that is another medicine for the, mainly for the BP actually, that is aldactone, that 1 daily. And telmisartan, that 1 daily. This is so many medicines for the BP and the heart. And metformin, vidagliptin and dapagliflozin for the, and Oxtra, that is for the diabetes actually. So he's taking so many medicines, and his blood parameters actually, with all these medicines, HbA1c is 8.8, and RBS actually, his wife was telling it was very high actually. HbA1c is very high initially, but because now he started controlling the and the high dose of medication, it is came down to 8.8, and currently he is 8.8, and insulin level is high, 53 actually. And lipase, that is another indicator of the pancreatic health actually. Pancreatitis, chronic pancreatitis, lipase is high, and the triglyceride and cholesterol and all are controlled, but the HDL is low. And the other parameters, the inflammatory parameters, ESR, HSCRP, CRP, troponin also is normal, because its acute cardiac phase is over. That means the troponin is came down to normal. And he's having a vitamin D deficiency is there, and also AMA, that is antimicrobial antibody. This is an autoimmune antibody that is positive. It is usually positive with the, usually just as an indicator of the early hypothyroidism, that is Hashimoto's thyroiditis. Maybe this is associated to him, that is an autoimmune disease. This AMA may be associated with the pain of the penis also actually, and PSA 6.11. That is the thing. And again, when we look into the echocardiogram of this, is hypokinosis of the, and there is clear indication of the cardiac heart attack is there. And carotid artery actually, Doppler studies actually is actually in the normal range, and the intima media thickness also is okay. That means that there is not much of atherosclerosis is there. And the abdominal, this prostate scan, there is fatty liver, and the kidney, there is some cystic lesions in the kidney, and prostate enlargement, and this residual urine also is there. So it is, your bladder is not fully empty. And the ultrasound scan of the testis also shows that there is plaque formation. There is left epididymal cyst is there, and also benign cyst, that is actually there is for, and also calcified solid lesions in the soft tissue of the penis on the right side in the mid lower part of the corpus cavernosum of 1.6 centimeter old healed inflammation. That is, usually it is called plaque. Actually, it is not like the arterial plaques, it is actually calcification or the fibrosis of that part actually. It is sort of inflammation of the penis also. So that is the situation in the initial workup actually. And when we come to the body parameters, where we are in the clinically supported lifestyle curve, body parameters are actually assessed in the most important. That is very important. Actually, what we are trying to correct is the body parameters and the body and the hormone system and the immune system. Then only we can correct all this metabolic process actually we are trying to correct it. His weight is 71 kg, BMI is 24.3. For the Indian, especially not working, sedentary work life, ideal maximum BMI should be 23. So for this patient, we want to reduce the BMI to low normal, and the fat percentage, and its fat percentage is high, 25.2. So we want to reduce the fat percentage below 50. And his BP was in the normal range, but with so many medicines. And abdominal circumference 90, and it is abdominal obesity is there. Next is actually what is done in this clinically supported lifestyle correction. In this actually we are giving a low calorie diet with all the nutrient, ensuring all the nutrient, especially the bodybuilding nutrient like vitamins, minerals, all the 14 vitamins, all the 14 minerals, and protein with all the amino acids in the correct proportion. That is also, each more protein, it's more important is the amino acid proportion of the protein we are eating, and also the dietary fiber in the correct proportion. Minimum 25 gram of dietary fiber is needed. So we are ensuring around 25 to 40 gram of dietary fiber. And this omega-3 fat, that is actually the healing power actually of the body's immune system. This healing or the repair work has to be done by this omega-3. The other inflammation and the attack is by the omega-6. The proportion of the omega-3 and 6 and 9 also is bodybuilding. Omega-3, 6, 9 in a special proportion to facilitate the body healing aspect. And special exercise, say a cardiac patient, so he cannot do heavy exercise or anything. So he is in the lying down or sitting a position, a systematic stimulation of the muscles, thereby the bones and the whole organs are stimulated, so that the heart is pumped in the correct, it is not in overexertion manner, and which will promote the development of the arterioles and arteries. And actually it is promoting the natural bypass. There is a problem, there is a really muscle damage is there. One thing, it has to be the repair of the muscle, already damaged muscle because of the lack of blood supply, and also to increase the blood circulation to that part, then only that muscle can develop. So increasing the blood circulation to the heart and the repairing the muscle and the blood vessels. That is the intention of all this actually. And then next, what was the result after starting? Actually, after starting, we follow the patient over as a telemedicine, over the phone we follow. And also again on the 8th day, patient has to come again. And in between, any instructions is given over the phone. And his discomfort actually was just discomfort was actually, by the 8th day, there was not much discomfort at all. Tiredness was continuing, but it was almost 40% reduction. By 15th day, it was 70% reduction. And day 30, the tiredness is gone. Actually, this tiredness is mainly because of this medicine. So much of medicine actually preventing his heart to block his heart to pump more blood and things like that. So many vasodilators, anti-BP medicines, etc. Actually, that is the reason for his tiredness. That tiredness is over actually, at least by partially reducing the medicine, he is okay with them. And he was always sleepy. That is also over by 15th day, 80%, 30 days. His sleepiness, tiredness and all is over. And the swelling of the and pain of the penis was over by the 8th day itself. And because he's had a massive heart attack, he was advised not to have sexual relationship because it is very intense activity of the heart may be needed. So till everything is, and so for the cardiac patients, it is especially after an attack, it is always restrained from the sexual activities immediately till everything is settled actually. Next, about the medication, when we look into, actually the diabetic medications was stopped in the first day itself, because it's a type 2 diabetes. The insulin is plenty, for actually excess insulin is there, so diabetic medication was stopped in the first day. Then by the 8th day, actually many of the medications has been reduced. This by 8th day, this telmisartan, aldactan, the two tablet were is actually stopped. That is two for the BP. The two BP medicines were stopped by the 8th day. That is because following up over the telemedicine, and by the 8th day, his totally he was initially taking 11 medicine, only 7 tablets was there. And also this Pramalot, that is he is taking for one tablet, it was reduced to half. And other Stovas, that is statin, also was reduced by 8th day itself to half tablet. And this flavid, because heart attack was there initially, we didn't reduce the flavidone or Ivabrad, we are continuing just like that. And also the other medicines we are continuing the same till 8th day. And by the 15th day when he came, and this Pramalot was completely stopped, and Storvas was only 1/4. That is, initially he was taking 40 milligram, it was 10 milligram reduced. It is statin. And this flavidone also reduced to half tablet, because he doesn't have any pain, or so we are seeing that any problem. And it is given the tablet which is to apply in the sublingual tablet, which is sorbitrate, which is given for if he is having any pain or any discomfort. But he never wanted, because when we are starting, all these medicines are working in the same way actually, to reduce the blood vessel resistance and reduce the intensity and the number of heartbeats and all, because to block too much of activity actually. So these medicines are slightly started reducing actually. The flavidone was reduced to half, but the other blood thinners we are continuing, and the Pantop, that anti-acidity medicine, we are continuing. And by the 30th day, actually, all the angina medicines were stopped actually, and even they had a cardiology visit also. And the cardiologist, usually the patients will not say that they are taking other medicines like this lifestyle correction, clinically supported lifestyle correction, and all. They will not say, because the doctor will fire them. So, but the doctor they didn't say about any reduction in the medication, but the doctor was very happy because his BP was well under control and the blood sugar was very well under control. So, doctors was very happy, so the patient is also happy. And actually, before starting this treatment itself, he had checked there was a clot inside the heart, no? And also the cardiologist did an echocardiograph and found that there is no clot inside his cardiac chambers. So the doctor was very happy, and he said he is fit for another angiogram and angioplasty. But this patient said that he will wait for some more time and then come. And by 30th day, only this Elaxiban and Ecosprin, only 2 blood thinners and pantoprazole, to prevent the side effects of acidity and all. So that he has to take for a year. Now only 2 months, by the time it is only short time. So 1 year he has to continue with both this, or at least one, up to 6 months anyway, because already one stent is put, he has to continue 2 antiplatelet medication for at least 6 months. And then depends on the condition it can, but I don't interfere with that usually till 1 year. After 1 year or 9 months, after 9 months, we may reduce 1 to 1. If all the other blood parameters and the body patient has brought the body parameters keeping in the normal range, the diabetic patients whose HbA1c keeping 5.5, and the BP is okay, then after 9 months we can reduce to 1 antiplatelet, and then after 3 months, 1 year, we can stop that also. Now we'll see what was the result according to the blood test. What was the result? He was diabetic, so his HbA1c was with all the medicines 8.8. But in the 8th day it was come down to 8.1 without medicine. By 15th day it has come down to 7.7. 30th day HbA1c is 6.5, and 60th day it was 5.7, and 90th day it is 5.3. So see the chronological readiness. The patient is also following everything correctly. That is why this very stable result actually. And initially the blood sugar was for 206, and on the 8th day it was 83. But actually this 83, it has come down to 83 in the normal range in the next day itself, within 24 hours itself actually. Because he is taking a low calorie diet, sugar cannot come like that. You can increase without you are adding, you are eating. Sugar will not increase. So he is put on a low calorie diet. It is actually the support food is low calorie, and he is advised to take only leafy vegetables and non-veg items. He is a non-vegetarian, non-veg items, and after when all the blood things are controlled, then he can take some carbohydrate also. So his blood sugar was maintaining always around 100 or below 100 actually, and his insulin level was come down to 2.1. Actually it was 52.8 initially, and it is come down to 2.1 by the 30th day. See, the pancreas workload is reduced, and the lipase level, that pancreatitis was there, that also reduced to enzymes come down, chronic pancreatitis gone, and the lipid profile, that is important for a cardiac patient, and his lipid profile was normal with 40 milligram of statin, but HDL was low. But by the 30th day, without this statin, his all the TG, that is triglyceride, cholesterol, and everything is normal, and the HDL started increasing also. 30th day HDL was 41, and by 90th day HDL were 51. See, all the other parameters also is normal. This vitamin D was low, it was increased by the 30th day also. It is not 25, increased, and it was normal by the 60th day. And AMA, that is actually this autoimmune antibody, that is not actually reduced much. So we had to, and also the PSA. PSA was came down, but it was not reducing. The AMA was reduced from 250 to 248 only. Next is the autoimmune antibodies. Actually, it was actually fluctuating. And the AMA was 250 initially. Again, 30th day it was 250. Then it was actually slightly increased to 550, 21. And then came down by 90th day to 291. And in the 120 days, it was 248. This is having that penile problem, that is Peyronie's disease is there. That is an autoimmune disease. That may be the reason. And also the PSA. PSA was, some patients, the PSA very fast decrease will be there. But for him, PSA is also, when there was some epididymal cyst and all. So we had given a course of antibiotic, maybe because of some infection it is said. But it was 6.1, reduced to 4.5, then again increased to 5.6, then reduced to 5.2, then 5.3, then 4.6, and finally by 120 days, PSA came down to 2.9. And also the scanning, the prostate size also decreased. Abdominal fatty liver was gone by 90 days. The fatty liver was gone, the prostate size also decreased. So that is the result actually. Our focus is actually on the body composition and correcting the hormones, metabolism and immunological aspect. His weight was initially 71 kg, and by 90th day it was come down to 64 actually. Weight reduction is not up to mark, and actually we are advised to him to bring down to 60 kg by 180 days actually. And BMI was 24.3, came down to 21.9. BP was stable throughout. Initially was BP normal, but BP was low normal at 100/70 and all. That is because of so much of medicines which is keeping the BP down. Actually, only after day 30, all the medicines is over. On day 60, his BP has come up to 120/80. So then only his tiredness is gone. Actually, before that, because of this high medicines which is decreasing the BP and cardiac function, he was very tired. After the medicines is over, he is okay. and the BP is okay, came to normal. Abdominal circumference was 90 in the beginning and came down to 85. Actually, he was expected to come down to 75. Maybe he by 180 days it may happen. And his body age was 49. Actually, it is tallying with his calendar age, but it has come down to 43 by the day 30 and 38 by 60, and day 90 it was 37. So he became 12 years younger than his calendar age. So that is also, so that change in his body age, I will reflect in all aspects of even his thinking, physical activity and everything, it will be reflected. That is the importance. Actually, we can anti-aging or reverse aging. Not only we are reversing the diabetes or hypertension or heart disease, even the age also is reversed and 12 years younger than the real calendar age. And fat percentage also is come down to 25.2 was the initial, and by 30 days it is 19.8, then 60 days 17.9, and 90th day it is 17.4. And whatever we are expecting is to bring down to less than 15%. It's all the result will depends on the patient also. When the patient, there is a tendency for the patients that when everything is symptom free or everything is okay, then relax, reduce on exercise and increase on food. So it can go in an erratic way also, but he's till 90 days he is maintaining everything perfectly normal. And he said he had a cardiology visit also, and he never said he has stopped all this cardiac medicine, but doctor is happy that because his BP, HbA1c is perfectly normal. So everything is normal, so he is very happy. The doctor is very happy and advised him to come for the repeat angiogram. But he said he will not be going for another because the doctor may compel him for the another angiogram, because everything is perfectly all straight. He is even troponin also we have repeated, everything is perfectly maintaining. Next, when we summarize or study this patient's case study, what is the inference? So basically you should understand that all these problems, diabetes, he was 10 years diabetes and diabetic and taking all the medicines, and hypertensive, so many medicines he was taking, and he was actually after this angioplasty he has landed it with chronic kidney disease also, kidney failure initial stage also, and even this PSA was high, prostatic problem is there, this penile problem, sexual problem, Peyronie's disease, autoimmune disease is there, fatty liver is there, so many diseases are there, and it is all within 3 months actually he's out from all these diseases. And he was advised to undergo a repeat angiogram and angioplasty, and definitely it will bring his kidney function down. And if not, again he has to, if they are not able to correct this 3 vessel disease, if it is not, maybe 2 or 3 or 4 stent may be needed to correct it. And if that is put, again he has to take all these medications after stent, or even if they fail to put the stent, he has to go for a bypass surgery, and again he has to take all this medicine. By putting stent or bypass surgery, his diabetes is not going, his hypertension is not going, any of the other diseases, liver, Peyronie's disease, or actually all these things, these medications will be adding his problems. Because autoimmune disease actually, all these medicines is acting as as far as body or the immune system concerned, they are all toxins. So everything will be increasing only actually. But with the 3 months, with a short time, actually it didn't take 3 months for getting out of medicine. Within a month he was out of medicines. So such a simple thing actually. It's actually our body is made of food. And the disease is a expression of the deficiency or excess of the food or the toxins or lack of exercise. If the patient is willing to correct it, it is very easy to come out of medication, come out of disease itself, and even to reverse age, or even you can become younger. This person was 49 years old and he came within 3 months, he's able to reverse his aging of almost 12 years. So only thing your willingness for this, and there is a way. Only if you such a patient, then he may not be able to correct all this with the self lifestyle correction, because the most important difficulty is how to do exercise. What is the correct way of doing exercise, and what is the correct food for the body? One person may food may not be ideal for another person. And finally, or the most important thing is, don't wait for getting a heart attack. This person, my patient was diabetic for the last 10 years. And he was carrying without taking some medicine and carrying like that. That is the reason for his this attack itself. So don't wait for an attack. Just correct your diabetes, hypertension, cholesterol, all these things earlier itself, before meeting a heart attack. It's if the first attack itself is a massive heart attack, you may lose your life itself. So there are so many patients who first this cardiac arrest, this massive heart attack and cardiac arrest, you won't be able to be revived. So find a early diagnosis of the diabetes and the correction. You can reverse. I want them to convey this message that you can reverse this diabetes, hypertension, heart disease, and every problems only with the willingness and correct support. So nutrition, correct nutrition and the healing type of nutrition and anti-inflammatory food for the, especially in the initial stages, this correcting stage, it is very important. And this, in this clinically supported lifestyle correction, actually what is the initially that we are correcting the body, and then it is easy for the patient to maintain it. And usually the patient will be able to maintain it, only thing once in a year or some checkup, and if there is something is gone wrong, correct it within a month. We will be able to correct it and keep the body parameters normal and the blood reports normal, and then you can be relaxed about your health itself. So that willingness and understanding that is the most important thing. Here in clinically supervised and supported lifestyle correction, what we are trying to do is use the healing power of the body by empowering the healing aspect, the anti-inflammatory aspect of the immune system. First is by providing optimal nutrition. Second, by promoting removal of toxins by improving circulation through optimal stimulation of all cells by planned exercise. Third, minimizing toxins entering the body through food, water, air, and cosmetics. Diabetes, hypertension, heart disease, liver disease, kidney disease, obesity, stroke, allergies, autoimmune diseases, and cancer come under the umbrella of lifestyle diseases. 90% of the medications and 90% of the surgeries are for lifestyle diseases. This means that 90% of the medicines and 90% of surgeries can be avoided. In the case of any lifestyle disease, the best treatment begins with the first step of diagnosing the underlying fault in lifestyle that is the cause of the disease. Next is corrective measures to rectify the damage and overcome both the disease and the need for continued medications and surgical interventions. It is good to understand that neither medicines nor surgery can cure a lifestyle disease. To put it differently, it is not a lack of medication or surgery that created the disease in the first place. This is why once medication is started, it becomes a partner of the disease for life. Very often, both the disease and medicines will keep on adding more numbers along with the unwanted side effects, with no hope to return to a healthy status, which not only affects the patient but also the dependents and caretakers. This is why it is very important for you to understand and correct lifestyle while also encouraging others to do so. Another important aspect is when someone is talking about healthcare and treatment approaches, you should consider the scientific background of the concerned person. I am Dr. Jolly Thomson, started medical education in Government Medical College, Kochi as 1981 batch and completed Diploma and MD in Obstetrics and Gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine, surgery, and painless labor, I joined government service. Later, I resigned from government service and in 1997 started practicing as consultant at Life Care Center, Devara, Kochi. I focus on lifestyle modulation with the clinical support for lifestyle diseases, minimizing need for medication and surgery. We believe the informed patient is the key to treatment success. You can find detailed content on different diseases, their treatments with emphasis to the benefits of lifestyle correction from website and YouTube playlists. The videos are prepared to understand more about the disease, the possible underlying cause, early diagnosis by understanding symptoms, current diagnostic methods and treatments along with the benefits and side effects, practical aspect of lifestyle self-correction and for those who may require clinically supported and supervised lifestyle correction. When a patient is having more than one disease and there are too many diagnostic and treatment modalities with many side effects, awareness of the benefits and problems of different diagnostic, medical and surgical interventions is the key to regain your health. Better informed patients take better decisions and live longer, healthier, happier lives. I would like to bring to your attention how the major part of the medications we take are excreted in urine, sweat and stool. It will reach the groundwater, rivers, drinking water, plants, animals and food products. That means the medication we take is becoming a threat not only to us humans but to all the life forms on our planet. Therefore, it is essential to correct lifestyle, reverse lifestyle diseases and come out of medications. To protect your children, grandchildren and the coming generations from the ill effect of toxic pharmaceutical pollution, we should come out of the dependence on medication. The current norm of chronic patients on lifelong medication has to change. Spreading awareness on optimizing and minimizing medication is the need of the hour. Thank you.